Today we have to discuss about the topic is lateral periodontal abscess in periodontal disease. The periodontal abscess is formed by it is related to a pre-existing periodontal pocket. That means people those who are having that periodontal pocket depth that is more than 5 millimeter, that leads to the accumulation of the food debris and bacteria. As a result, the bacteria can multiply and leads to the formation of abscess. So the plaque formation is the major factor leads to the formation of abscess, that leads to damage the cortical plate, leads to that mobility tooth occur. The three precipitating factors lead to the formation of lateral periodontal abscess. That is, one is the subgingival flora. The subgingival flora is nothing but it is the flora that is a bacteria which presents on the oral cavity that helps to digest that food debris and epithelial remnants of our oral cavity. So in these bacteria and those who are having the weak immune responses, so those people having weak immunity, as a result these bacteria easily affected those people and leads to formation of abscess. Sometimes combination of periodontal pocket depth and those people who are having weak immunity, this leads to formation of periodontal abscess, that is lateral periodontal abscess. That there is a normal periodontal depth is about 3 millimeter, but this condition lateral periodontal abscess people periodontal pocket is having that 5 to 8 millimeter depth. So increasing the depth, as a result the bacteria can easily multiply. Naturally our tooth has a self cleansing property, but in this case the increase in periodontal depth, as a result the bacteria can easily multiply and cannot be easily removed from the periodontal pocket. So bacteria is pay the way for helping the bacteria to grow more to form the lateral periodontal abscess. So this abscess leads to damage the cortical plate. So the cortical plate leads to form the abscess. That abscess look like a gum bile appearance. This is a gum bile appearance. This appearance will be seen in this area. Clinical features, usually it is mostly occur in adults because the children isn't having teeth, at the same time that they have a deciduous teeth, and also older individuals nothing having mostly having the gingival recession and they having a loss of teeth occurs. But in young adults having a periodontal pocket, sufficient amount of periodontal pocket for the help of bacteria. So as a result it can be easily affect the young individuals and leads to the formation of this kind of periodontal abscess. And foreign body is the most common cases for the development of periodontal abscess, because especially the food particles get accumulated, those people having increase in periodontal pocket depth. So food particles get accumulated and leads to help the bacteria to grow further, and increase in there is a pus discharge in the oral cavity, so the people may experience the foul taste, and the mobility of the tooth will be seen. The mobility of the tooth is due to that this abscess damage the cortical plate, so mobility of the tooth will be seen, and lymphadenopathy also seen. That lymphadenopathy is nothing but production of inflammatory cells. So wherever the inflammation occurs, the inflammatory cells get produced by lymph nodes. So enlargement of lymph nodes called lymphadenopathy. So in this case the lymphadenopathy is common. The occurrence of periodontal abscess is mostly seen in cortisone treated children having rheumatic fevers. Those who are having rheumatic fever and treated with the cortisones, that children having periodontal abscess, because the cortisone stimulate the osteoclastic activity or osteoporosis activity. As a result, periodontal pocket increase the depth of the periodontal pocket, so bacteria get easily accumulated and form the lateral periodontal abscess. In histology, the central cavity is filled with pus. At the same time, the epithelial lining of the crevices, this is the crevices area, this epithelial lining, this is the epithelial lining, this epithelial lining get ulcerated for further manner, for clear manner. This is the area have those who are having that periodontal abscess, the plaque area, and this area you get ulcerated. The below the ulcerated area, there is a formation of inflammatory self infiltrate will be seen in this area, like this is the histology picture of the periodontal abscess, peoples. Here we see that the abscess in this area, and here is the plaque materials that leads to the formation of increase in the size of the abscess. As a result, below this area having inflammatory cells also seen in the below the lining epithelium. If the treatment is the direct incision of the perpendicularly incision the gum bile area, that is the periodontal abscess, perpendicularly incises the periodontal abscess and help to discharge the pus. Sometimes that pus can't release properly, that leads to the formation of fistula and intermediate pus discharge from the oral cavity. In order to avoid those conditions, we use that periodontal probe to run the periodontal pocket to further releasing of to complete releasing of the first for better curing. Thank you.